Stresses and mental health in dental school. Stay tuned. This is a topic that many prospective dental students ask before starting dental school, so that's exactly why I decided to make a video on it. You gotta keep yourself in check because this is gonna be the most challenging and stressful experience you'll ever go through in your entire academic career. Hello everyone and welcome back to another video. My name is Teham and I am a second year dental student at ASDO. Timestamps for the video are going to be right over here, so go ahead and feel free to scroll through along any part of the video that you think is going to be most worthwhile to you. And as always, if you find anything here of benefit, please consider leaving a like down at the bottom and letting me know what you think in the comments. I'll be going over how mental health comes into play here and the many stressors a dental student should look out for and the things you can do to get through them all. Now, unfortunately, the truth is mental health is not looked at as an important factor when evaluating students' performance. It's something that just recently became a factor that people are acknowledging in the last decade more than ever before, which is a good thing. But typically, if someone's not performing well in a class, the school, institution, or people teaching the course don't ask the student about their mental health first. That's just how it is, unfortunately. I mean, just think about it. If someone's struggling through a class, the first thing that comes into the institution's mind or the person who's teaching the class is they're not studying enough. There's something that they're not doing right. Now, poor performance in classes paired with difficulties somebody may be going through in their personal life leads to potential depression, and it's real. Now, if you know you're showing signs of depression or going through something mental health-wise, the most important thing for you to do is to reach out to whatever resources you have at your school. A lot of graduate programs have campus guidance counselors, and they can be really helpful to reach out to just explain what's going on, and they might be able to suggest things for you to cope with whatever you're going through. Now, if you yourself may not be going through anything, chances are somebody around you may be going through something. So it's very important for you to observe that, and if you see potential signs of depression or something that somebody may be going through mental health wise, it's important for you to reach out to them and provide whatever resources your campus may have for them to be able to, just reach out to someone, talk about whatever they're going through. Now, I'm not going to beat around the bush. This is very crucial to understand because it encompasses all levels of academics. According to the CDC, suicide is the second leading cause of death amongst high school and college-age students. Talking about this early on in academic stages can really go a long way. And again, one of the most important takeaways from this is that if you observe that someone's going through something, you definitely want to provide them with the appropriate resources for them to be able to figure things out. Now, this is kind of obvious, but I think people sometimes forget this, is that each individual person has a life outside of school. So naturally, that means that you're gonna have a lot of things to deal with. You're gonna have family, friends, relationships, financial things you gotta figure out. So there's a lot of additional stresses and burdens that a student will have outside of whatever's going on in the classroom. Just gotta prioritize things and know that you're gonna have to put in effort in things outside of school because at the end of the day, you're more than a student. You've got your own things you gotta deal with. Now, with dental school, obviously everyone knows that your first few years you're going to be doing heavy didactic science work, and you're going to have to constantly juggle through a lot of classes and have to take exams every single week. Now, at my school, I really like the way it's structured because we go through a modular curriculum, so we don't really have to study for additional things simultaneously. So we're only taking one class at a time, and by the time that class is finished, the next week we're starting the next class. So I think that really allowed for myself and my class to really put our best foot forward and really just, prioritize everything one class at a time. And I think that really worked out for us. Now, that being said, it's still pretty challenging to have multiple exams every week, multiple quizzes. It can be really draining. Now, the stress that comes with these didactic courses because of the constant flowing of exams every single week is that, let's say someone's not performing well, right? And they look at their grade and they base that grade on the fact that they just can't do it. they can't get a higher grade. They're not capable of getting a higher grade. When a very simple tweak in studying methods can really just, change the entire situation. So a couple things you can do is, if you're a flashcards type of person, go ahead and check out the Anki resource. You can actually make your own flashcards, and it can be a really efficient and beneficial way for you to remember things if that's the way that you learn best. Now, I personally love note-taking, and I actually went over the way I take notes in dental school using Notability. So if you're interested in that, go ahead and check out this card where you can see how I do that. Now, an additional stress that you're gonna have to deal with, because at the end of the day, you are a dental student, is sim clinic. This is a very unique type of stress for a student to go through, because it's one of the only graduate programs that tests students in this way. We're told to make certain shape designs with different sizes, different dimensions, different depths. So doing that in the beginning can be quite stressful. A tip one of our sim faculty actually gave us was that from the first day we started sim, they were saying that your first 2 or 3 preps for the day are the best work that you're gonna do the entire day. Anything after that second or third tooth that you're gonna do will definitely not be your best work, because you're gonna be so fatigued, tired, and frustrated if you're not getting what you want. So the important takeaway from this is you definitely don't wanna rush anything, especially your first 2 to 3 teeth that you're working with for the day. You wanna take your time, make sure you're going through your manuals, your rubrics, and making sure you're drawing with pencil. When you're starting off, you definitely want to make sure you're doing everything correctly. Ask questions. That's what your sim faculty is there for, so definitely take your time. You definitely want to take breaks. Get up. You're sitting down for so long because you're getting a taste of how the daily life of you being a dentist is going to be. Walk around the sim clinic, see how your fellow classmates are doing, go outside, take a little walk, and then come back. Those are all really good ways to manage with the stress that you're going to be going through in sim clinic, because I promise you it is going to be stressful. Now, with the main patient clinics in your 3rd year, when you're going to start going there, everything in sim clinic that comes into stress is applicable here too. But the thing is that you're also going to have to add in the patient and human communication aspect there as well. Everyone's going to be different. All the patients are going to bring something different to the table. They're going to be from different backgrounds. So you're going to have to deal with that and figure out how you can effectively do that. Now, again, similarly with the sim clinic situation and how to deal with those stresses, you definitely want to take breaks in between patients. Not like insane breaks. When you have to disinfect the room and stuff, that takes some time. So if you take like a 2-3 minute break and walk outside, or just, clear your mind and just figure out where you're going to do next, that can really go a long way, because at the end of the day, we're not robots. We're humans that are having to physically do things and move around and get things done. Also, another important thing, even in sim clinic and with the main patient clinic, stay hydrated. So much time goes by while you're working and you forget that you haven't eaten or drinking anything. So definitely have a water bottle handy so that you can definitely keep hydrated, because that's one thing I struggled with, and I literally forget that the whole day I didn't drink water. And yeah, don't do that. Now, you wouldn't expect this, and most people are surprised when you tell them this, but dentistry is very demanding physically. You're sitting down for so many hours and moving around in like so many unnatural positions for so long, and that can really stiff up your body and your muscles. That's why it's really important to be involved in physical activity and just get your blood pumping and your muscles to get stretched and relaxed a little bit, because just scrunching up like this and moving around and staying in a stationary position can really just affect you physically with your back and your neck and a lot of other parts of your body. So the more you stretch out those muscles and activate everything, it can really go a long way for your actual career. If something gives out in your body, then that's going to affect you in your career, so you definitely don't want that to happen. Podcast videos are slowly being uploaded on all podcast streaming platforms, and we just added Spotify onto the list. So if you listen to Apple Podcasts, Google Podcasts, or Spotify Podcasts, you'll slowly be starting to see all the episodes that we have with the podcast conversations uploaded on those platforms. So stay tuned. Currently, we're on the 2nd episode, so we'll be going on and uploading everything on a sequential basis. So stay tuned for that. Anyways, those are the few important things that I really wanted to talk about regarding mental health and stresses and how to deal with them in dental school. We'll catch you guys in the next one. Peace.